history. So under this session, we will assess if the patient has any childhood illness like chickenpox, measles, or any vaccine preventable disease, and even his vaccination or immunization history. So the other thing is if there was any recurrent childhood illnesses, whatever the disease is. For example, in a country like Ethiopia or other developing countries, the most common cause of heart failure is rheumatic heart disease. And this rheumatic heart disease, it doesn't happen overnight. Rather, it's a progressive damage to the heart, which traced back to the childhood time. And it is associated with recurrent attack by rheumatic fever. And this rheumatic fever is associated with gas infection. As when we assess a patient with rheumatic heart disease, they will tell us that they have repeated or recurrent episodes of tonsillitis during their childhood, and they took traditional herbal medicines for the treatment of the condition by the time. So they didn't get any prophylaxis. For that reason, repeated attacks of the heart will cause rheumatic heart disease. So some disease conditions are traced back to the patient's childhood time. So it's good to assess if the patient had any illness during the childhood time. So this is one of the components of past medical and surgical history. The next thing is we need to ask the patient about if he has any medical conditions like RVI, tuberculosis, diabetes, stroke, cardiac illness, renal conditions, and the like. So any medical conditions in the past should be assessed. The other thing is if the patient had any previous history of blood transfusion, and if he has the experience of blood transfusion, we need to ask him if there was any blood transfusion reaction. So this will help us to be cautious if we plan to have blood transfusion for the patient for different reasons. It might be treatment as a treatment for anemia, or the patient might need surgical intervention, and by the time he may need a blood. So knowing this history might be helpful to be cautious for transfusion reaction. The other thing is whether the patient has any previous malaria attack is important history. The other thing is we need to assess surgical histories. If he has any surgeries, any trauma or injury, or the presence of any fractures. So all these things should be mentioned under past medical and surgical